And we'll just give it another second or two for everyone to join in. I still see a few people popping up here. All right. Well, it is 1 o'clock in Wisconsin, so we are going to go ahead and get started. Again, I am Amy Ryan. I am one of the health promotion program coordinators with the Wisconsin Institute for Healthy Aging, otherwise known as WIHA. And Mind Over Matter is one of the programs that I oversee. So, very happy to see everyone today. We are going to do introductions in just a moment, but let me share my screen so we will all be on the same page, hopefully. Let me just make this a little bit bigger. Jill, can you just give me a thumbs up if you can see my screen, the Mind Over? Perfect. Thank you. Thank you. So, welcome to our January national gathering of our Mind Over Matter license holders. So throughout the United States, it's good to see everyone. And what we're going to do is we do have a little of agenda today. We might get it done a little bit early. It just kind of depends on questions. Our agenda for today is we're going to do some introductions and an icebreaker. We're going to talk about our impact, the annual report. Yay for annual reports. Everybody's excited about that, right? Okay, maybe just Erin and I and Jill are excited about that. We are also going to talk about some feedback, some successes that you have been seeing in your communities, because that is very helpful to us at WIHA. And also some challenges. Where can we help? Maybe with some of those challenges, we're going to rely on each other. It's not just going to be the WIHA staff talking today and myself, but this is where I really want us all to interact. There might be some really great ideas that are happening, and we just want to make sure that we're sharing those across the board. I will have some feedback is where we're at. Then we'll do the WIHA updates. I have just a few highlights that I want to make sure that I go over before the end of the day today or our session. So what I would like to do is we have 20 people on today. How exciting is that? I would like for you, if you could, just in the chat, go ahead and put your name, the state and the organization you're working with, how long you've been implementing Mind Over Matter, and I know there's going to be some big numbers there, and what's your favorite go-to comfort meal during the winter? That was something that I was thinking about. And I know for me, it's any kind of casserole. If you live in Wisconsin, it's called a casserole. Other parts of the United States, it might be called a hot dish. Anything I can put in a casserole dish and pop in the oven and it cook in the afternoon while I'm working and be able to eat after in the evening is the best thing, I think. Just something kind of comforting there, whatever that might be. So if you want to go ahead and put that in the chat, that would be great. I'll have to open my chat so I can kind of see it. All right, Linda, you're in Colorado. And it's turkey chili and cornbread. That sounds pretty good. Soup, Erin likes soup. Marianne out in Maryland, baked ziti. Oh, I'm going to be making that this week. It's on my list.
Oh, I love
Julie,
that.
Julie in Colorado, green chili casserole. Ellen is out in Colorado also. Hot pot. Okay. Corinne out in New Jersey. Chicken pot pie. We have Renee in Illinois. Some kind of stew. I made stew for the first time last week because my husband loves it. Not my favorite, but it was pretty good. So that was good. Maureen, mac and cheese out in Connecticut. Great, great. Stacy's down in Kentucky and she's liking some soup. Jill. Oh, soup. You're right along with everyone else. Claire over in Michigan, welcome to you as well. Chicken chili, shepherd pie. Oh my gosh, now I'm getting really hungry. My leftovers are not sounding as good as some of these things that you all are putting in the chat today. All right. Well, great. Well, we have a great representation from around the United States, so that is fun too. As we were talking about earlier, it's a little chilly up here in Wisconsin today, so I would like to be in Arizona. I know I've got some folks from Arizona on as well. All right, so we're going to start, jump right in. Big thank you. The staff at WEHA just wants to say thank you all for your commitment to delivering this really impactful health education program in your communities. And we really truly couldn't do it without each and every one of you. So just it's a new year, but a big round of applause. We're going to talk about where we were, where we've been in 2024 and kind of the impact. But before we get there, I already forgot I was going to do something else. So we have Jill Rankin, our executive director on, and Erin Eggert, our deputy director, and I'd like them to just introduce themselves before we get too far in the presentation today, just in case they have to jump off. Jill, you can go ahead first.
All right. Thanks, Amy. Hi, everyone. I'm Jill Rankin, the executive director here at WEHA. And it's great to be here. Like Amy, I don't know that I was looking forward to it all week, but I will say it is one of my favorite things about January, is being able to talk with all of our partners around the nation. Because we are here to support you. We're here to not only create evidence-based programs and disseminate them, but also to support the great work. So we really appreciate you and really want to hear from you today as far as what's working well, what's not working well, like Amy said. So I'm excited to listen and learn from you all today.
Hi, everyone. This is Erin Eggert, Deputy Director with Mind Over Matter. On the back end, I handle a lot of the licensing things and then also the basic training. So if you ever have any questions about that, I'm your go-to person.
Thank you, Erin and Jill. I appreciate both of you. And we are definitely a team at WEHA, but I always like to say this is my Mind Over Matter national team. Like we are all teammates together working to spread this great program. So I want to just, Jill, do you want to go over this impact sheet or would you like me to do that today?
I can do it because it's been really fun to see the growth and the impact that we've had since starting Mind Over Matter dissemination nationwide. Many of you know that we started it here in Wisconsin. We piloted just from an idea. We're working with Dr. Heidi Brown and some of the senior centers here in the state of Wisconsin. And it was extremely popular, extremely well received, and obviously evidence-based. So we saw some extremely good health outcomes. So it's been really great to see that expand throughout the nation now. So in 2022, just to look at like where we've been and where we're at, we had 25 facilitators in the very first year that we started, 8 different states, and there were 72 workshops. And then in Wisconsin, we had 35 facilitators and we held 51 workshops. That was in 2022. Now in 2023, we definitely saw some growth, some good steady growth with 29 facilitators. We had a master trainer nationally trained and 11 different states that were working on Mind Over Matter. And then in Wisconsin, you can see our numbers actually kind of decreased a little bit in Wisconsin with our facilitators, but then we increased by training more master trainers, which then led to the growth in 2024. So in 2024, we had significant growth last year. So we had 52 facilitators now nationally, 4 master trainers and 12 different states. And then 3 of those states have 2 license holders. So there's multiple communities that are receiving the Mind Over Matter program within different states and different areas. And then when it was in Wisconsin, we grew back up to 43 facilitators and we have our 4 master trainers and we did 52 workshops in 2024. So thank you all. This is great to see and I'm looking forward to what we see for 2025 growth as well.
Thanks, Jill. Yeah. I thought when I was putting these numbers together, I really love to see how many new national facilitators that we have trained just in 2024. So that was really a great number to see increased. All right, so let's get into the nitty gritty of some things. So license holders, we're going to talk about the annual report. So if you've been with us for a while, license holders, you've filled this out in the past. But we will be releasing tomorrow is the big day. we will be sending out a constant contact with those annual reports, that information on what we're looking for to get back from you. Those will be due on March 15th. So if you can kind of keep those numbers or those dates in mind, that would be great. And there's actually two parts to our annual report. So there'll first be a survey link that you will fill out. And as I remember the survey link, you're going to have to go through it all at the same time. So it's not something that you can go back and add to. So just make sure that you're thinking about that. And then there will also be a facilitator spreadsheet. And I do have that up so you can see kind of what that looks like. Can you see the facilitator? It's probably going to be too small to read, but don't worry, you'll get it in the constant contact tomorrow. Really what we're looking for is we want to update your license holder organization name and who your contacts are so that we have the correct names and contact information. Not only email, but phone number is also helpful. And then you'll go down on the bottom part and you'll fill out who your active facilitators are, their email and phone number, as well as the date of their training, if they've had a fidelity check done or not, and if they passed their fidelity check. So we'll talk a little bit more about fidelity checks in a moment, but this will be on your 2024 facilitators and master trainers as well. So a couple organizations have some master trainers. Any quick questions on this form? Okay, I'm not seeing any. And then we will also have, if you have affiliates, there's an affiliate tracking form as well. So if you have some affiliates that are working with your license, go ahead and you'll fill out that sheet as well. And I believe, Erin, if they don't have any affiliates, do you want them just to still fill this out and put none in on their sheet?
Yeah, that would be perfect.
Okay. Thank you, Erin, for that. So just as a reminder, this is very helpful for us just to kind of keep track of what facilitators are out there. And then that helps me with our tracking system here. And again, so the report is just the 2024 activity, the facilitators that you've had trained, those workshops that you've implemented, the number of participants is also going to be collected on those reports. And then we do have some optional questions that will be at the end where you can fill in. We are looking for some testimonials from both participants and facilitators. This is really great for us to use in promotional materials, when we update our flyers and brochures, to have some testimonials from some of the ladies that have taken the workshop. That is always a great thing. And then implementation successes and then the challenges. We love to hear and celebrate the successes, but really we want to hear about what is challenging, because if it's challenging for you, more than likely it's challenging for another organization, and we want to try and address those challenges or those barriers. So that's the annual report. Any questions about that? No. All right. Some important information, just as a friendly reminder, it's always great to just keep an updated list of who your facilitators are that are working under your license. This is important because we at WEHA, and when I say we, I probably mostly mean me, if there's any changes to the facilitator manual or any of the procedures that way, I'm going to get that information to you as license holders, and then you're responsible for sending that information on to your facilitators. So just keep in mind that I will send information to you, and then you pass that on to the facilitators. Another thing is we do have on our website a map that helps participants find workshops in your state. So one really interesting thing that happened just 2 weeks ago, which I think is really interesting, is someone called us from Massachusetts. I believe it was. They had read something about mind over matter in a Harvard newsletter.
Wow.
And they wanted to take a workshop. And I was like, yay, this is great news. And I was able to connect her with a virtual workshop that was happening. But when I go onto our website, when we get to the WIHA website and under the updates, I'll show you where that is. So if your organization is interested in having that contact information on that map, it is helpful not only for me, but for folks that are just on our website looking for the Mind Over Matter workshops that are happening in different communities. So I reached out to Dr. Brown, the developer of Mind Over Matter, and I was like, did you put something in the Harvard newsletter about mom or the Mind Over Matter program? And she's like, no. And so it's a mystery as to how that even got in that newsletter. It's pretty cool.
Mm-hmm.
All right, so here's where I'm going to be quiet for a moment. I'm going to stop sharing. I was going to try and use a whiteboard, but it's early in the year. I'm not super good with the whiteboard on the computer, so we're going to put things in the chat and holler them out. And I'm doing old school pen and paper here on some things. So what I'd like to do is just get some feedback from the group on things that have been going well with your Mind Over Matter program in your state. And then we'll talk a little bit about the challenges and how WIHA can best support you. So I'd like to see everybody's faces. So I'm going to stop sharing my screen. And we'll just open it up for discussion. So does anybody want to give us a success, or you can put it in the chat? All right. Those who take the class really.
This is Karen.
Yes, Karen.
This is Karen Richards, and one of the things that I find that most people benefit from is understanding that they need to eat more fiber. They're shocked. The majority of them are shocked that they eat so little fiber.
Exactly. That's good to hear. Good to hear. Stacy has put in the chat, those who take the class enjoy the class. Attendance is always robust. I like that, to hear that the classes are filled with a waiting list and have offered it, hosted 2 every month. Great. Claire, you're in Michigan, I believe, if my memory serves me right. Everyone who takes the workshop really appreciates it, and we have no problem with scheduling new classes. I think that's really great news to hear from our end that you're having waiting lists. Isn't that a great problem to have with this workshop? People love the video. Okay. Participants have commented on enjoying learning more about their symptoms, enjoyed associated snacks with each session, and they feel symptoms improve and empowered per our surveys. Colorado, 7 workshops that were fully attended. The program is very well done. People always learn something. Great. Well, thank you for these comments. You can keep them coming in too. But I think that's what we're hearing in Wisconsin as well, is that this is a well-received program, and that the women are interested in learning the points in the class, as well as the classes are being filled. All right, great. All right, so now we'll flip the coin. What have been some of your challenges?
Yeah, in Idaho. One of the challenges that I see is we don't have any problems getting the class full. What tends to be seems to be a challenge for us is people that aren't able to necessarily make all three classes. They'll have illness pop up or just scheduling conflicts. And that's always a bit of a challenge to kind of deal with because we, of course, let them know that they need to take the whole class for it to be effective. So I'd love to get some feedback from anybody about how they handle and approach this.
Pam, thank you for that. Go ahead, Claire.
I've also ran into this issue working at a senior center. Emergencies come up, accidents happen, they get their doctor's appointment. So one thing that I have done in the newsletter, whenever we advertise the class, I make a note after the description, and I just say, I can't say attendance is mandatory, but I just put a little blurb in there like, with this class only being 3 sessions, it's very important that you make sure ahead of time that you don't have anything on one of the days that we are running classes, because there's a lot of valuable information that we cover in each session. And I think for you to get everything out of this class, you really do need to attend all 3. I have not ran a session where I have had 100% attendance every single time. Maybe one day I will. But I add a little blurb after the newsletter information. And then I just let them know if it doesn't work out, we'll be offering the next one on. And then I kind of give them dates and keep a little interest list of people.
Yeah.
Thank you, Claire.
Did you ever consider having 3 consecutive weeks instead of every other week? Because I almost think that maybe they not lose interest, but they almost forget.
That's a good thought, Marianne. That is definitely something that we can bring back to Dr. Brown and the researchers. Jill, I see you coming off of mute. You want to answer that as well?
I can just maybe give a little insight as to why we have it that way, because we have heard the same thing in Wisconsin too, where people want it every week, which is great. The reason why we made it every other week is because we know that it takes about 6 weeks for people to establish a habit. And we were trying to make it as easy to implement as possible because people didn't want to attend a 6-week workshop. So that was the logic behind it. But certainly I would encourage if any of you are having those discussions to talk with folks just to say, would you be willing to take a 6-week workshop? Instead of just 3 sessions back to back, and just kind of get some intel on that. That would be really helpful for us. And we can certainly bring that back to the program developer. Thank you.
All right. So some other, I think that is an emerging comment that I'm seeing in the chat as well, as just getting folks or ladies to come to all 3 sessions. Mary Ann, do you want to expand a little bit about having a harder time getting participants for your in-person classes? Are you filling virtual workshops?
Yes, it's just the in-person. The last 3, I think, were all virtual. And I didn't teach those. I taught the in-person, so I'd have to ask Donna, was there 100% for the 3 weeks, or what 3 sessions, or what happened with that? But I do know that they advertise the online and they get a better response. I don't know quite why, but it has been hard. She has heavily advertised, Donna, who is the director for the Baltimore Department of Aging, and she has heavily advertised it, but we haven't had an in-person one for over a year now.
That's interesting. Is anyone else seeing this in their state, where either virtual or in person?
I do just want to add one more thing, that when I've talked to some of the other senior centers, they've said that they've had trouble. I don't know if it's a Maryland thing or the senior center thing. They have had trouble filling other programs as well.
Amy,
Okay.
this is Pam Pearson
Mm-hmm.
again in Idaho, and we actually, when we started our Mind Over Matter courses, it was in the heart in the midst of COVID, and everything was really switching to kind of a virtual attendance situation, everything kind of in the health world, and so we have primarily run our classes online and have been quite successful in that way. We had to make a few little technological tweaks to the PowerPoint. One of the things that we did was we did a screenshot of what page they're supposed to be on and inserted it into our PowerPoint so they could see exactly what page they're supposed to be on as we flip through the book. And then we also, instead of having them, of course, write letters to themselves, because logistically that can be a little bit difficult when you're not in the same space. I actually record their goals each week in an email template, and then wait a few days after class and email it to them midweek, which is kind of neat. We seem to get really good response from that. So yeah, for our in our world, we've really done most of our classes primarily, and attendance has been solid that way, particularly in rural areas of Idaho's a largely rural state, so it's particularly helpful that we offer that online so that people can attend more readily.
Thank you for sharing that, Pam, as well.
Yeah, yeah.
Well, and I think too, maybe it's virtual is easier for some of the ladies to get to. Maybe just the thought of talking about this topic in a bigger group may be a little bit scary as well. But I'm so happy that we have it in both formats, that it can be both virtual and in person. I think that what I'm hearing, at least in Wisconsin, is more of the older adults are starting to want that in person now that we're a few years post COVID. But some are now really used to this kind of a format of a meeting. Here we are, we're across the United States and we're all on one screen and not in person. Anyone else have any thoughts?
Hi, Amy. This is Lynette.
Hello, Lynette.
Hi. I'm sorry, I had to turn something off. Yeah, I have those problems too with getting all of the participants in for the 3 sessions. So what we've been doing, and I'm in the Detroit area, kind of just schedule in a bonus session at the end for those that miss a session, they have an opportunity to come in and get that information through that bonus session, which also helps with our funders for that attendance that they need for their further grant writing and things like that. And that's been working pretty well. Another issue that I have personally, and is that fidelity to the model. Sometimes I've had just a little difficulties with making sure that my organization is following the fidelity to the model. And I'm pretty much of a stickler about it. Maybe it's my military training, I don't know. But I'm a stickler for it. And so I have to oftentimes kind of like double check, triple check to make sure that the things that I need to run this class is in place. So those are my 2 comments.
Thank you, Lynette. I take fidelity of this program very seriously because it is an evidence-based program. So we do want to make sure that the ladies are receiving the same information, whether they're in Michigan or Wisconsin or out in Connecticut or, across the whole United States. So we do want to make sure that our facilitators are following the facilitator manual and that the ladies are getting the same information. Because it is evidence-based, we want to make sure that all the ladies are getting the same outcomes or have that option too. Jill, do you want to say anything else about Fidelity?
No, I think you said that well. We want to make sure that they're receiving the benefits of the program. So thank you, Lynette, for being a stickler on Fidelity, but also we want to make sure that we have flexibility in areas that we can have flexibility. So if anybody has any questions or ideas about things that they may need to adjust, then Amy's happy to talk with you about those and brainstorm some things that we could have flexibility on versus things that we can't. So it's always a great discussion. So I encourage that. Thank you.
Thanks, Jill. And we want to be mindful of cultural differences as well. So if there are some cultural adaptations, maybe that would be something that we could talk about and definitely bring back to the developer of Mind Over Matter and make sure that we have her input as well. I know that Jill and I and Erin have been working with other programs, and we've been talking about cultural adaptations for other programs. So we're not changing the materials that are just, we talk about during the workshops, but maybe we're adding an extra 5 to 10 minutes to the beginning of the workshop so that the ladies have some time to gather and visit. So that when it gets to be the start time, we can start in time and end on time. Maybe it's some different cultural foods that you have as your high fiber snack. So there are some other adaptations that we can make, but just reach out to me and we're happy to talk through that. I've already heard some challenges. And I've already thought about some things that I'm going to work on in 2025. And Pam, you gave me the idea, and actually we've talked about this. I've talked about this in our team meetings, is adding those screenshots in for those virtual workshops. So I'm happy to hear you say that, and I'm happy to go ahead and update those slides for your virtual workshops and add in those pictures to make it easier for the participants.
Well, Amy, I would be happy to share back what our PowerPoint. I mean, since the work is kind of already done. So if you'd like, I can send that to you.
That would be great. And then I can make sure that we have all the other information that needs to be on there as far as
yep.
for the copyright and things like that, and we will definitely get that up and going. So thanks, Pam, for sharing that with me.
Absolutely. It's been very helpful to have those, actually. It's kind of helpful as a facilitator as well, because especially in an online form, it can be a little bit of a challenge to kind of, switch back from screen to book and screen to book. So
great idea. The other idea I heard is maybe making a little adaptation to those friendly reminder letters if you're doing a virtual workshop. I do like the idea of sending those reminders out as an email on those off weeks. And I have done a little bit with some of the other facilitator trainings talking through how we can best serve or kind of adapt in our virtual tips and tricks sheet. So I will be sending that out hopefully this quarter so that you can get that out to your facilitators as well. So again, we're not changing anything. We're just changing how we get those friendly letters to those virtual participants.
I will say it's also been kind of nice, Amy, because you often get a little bit of an email reply from your participant, and if they have questions or a little note about how it's going, it's kind of a nice way to continue to interact with them about the class, and that also keeps them, I think, interested if you can have that midweek correspondence. Not that they lose interest, but there's a momentum that comes with the class, and so that every other week thing, if you're not talking to them at all, that momentum can easily drop. And so that tool, by virtue of just kind of having that email connectivity with them for a reason is kind of a nice way to keep them energized for that every other week class. Whereas with just a letter, you don't have that interaction. So
that's very good too, Pam. And we will take that back to the developer as well. These are great ideas and thoughts. Any other challenges? All right, well, feel free to put anything else in the chat, or if you would rather reach out directly to me or any of the staff that we have, we're always happy to hear those successes and those challenges. Any other ways that we could support you? That's my next question on the feedback sheet that you can't see because I'm not sharing my screen right now. How else can we best support you as Mind Over Matter license holders?
Donna asked me to ask, how often are the resources updated on your website?
That's a really good question, Marianne. So we were going to go over that in just a moment, but I did update some of the marketing materials in 2024, some of the flyers and the social media, and I'll show you that in a moment. But unless there's a big change, we don't have any updates to the manuals or the participant guides. Those are pretty set. Data collection, we're going to talk about that also when I talk about the updates. So that has been updated. So there's not really, I guess to answer your question, there's not really a set date that we always update. We're kind of ongoing updating materials.
This is Patty with Aging Best in Missouri. We've been struggling with struggling with getting people trained after our last facilitator left. I know that we've got an online workshop coming up at the end of this month. Is it too late for us to toss some people in that workshop?
It probably is too late to toss people in that workshop just because they have to do the basic training. I'm looking at Jill, waiting for Erin to give me any other indication.
You're referring to the January training? Yeah.
Right.
Yep. And I think that's pretty close to being full as well. So that one wouldn't be available. And then do you know off the top of your head, Amy, when the next training is?
I do know that it's not until August. So Patty and everyone else, this is what my recommendation is if you have folks that want to go ahead and be trained, go ahead and have them fill out the facilitator application or registration form. When they get to pick a date for a training, just have them put in general interest. If I get 5 to 6 general interests, or maybe even 4, I will work on scheduling another virtual training.
That's great to know. Thank you.
We are here to help out. So we just had to kind of pick some dates for virtual training in 2025, but I am happy to add extra trainings if we need to.
Wonderful. Thank you.
Mm-hmm. Anything else that we can do to help?
Maybe you're going to cover this, but Donna also wanted me to ask if there's anything in the pipeline that would allow the program to be for men. She's had several requests for a men's program.
Yes, I know that she has.
And so Idaho has as well.
And Marianne, she's not the only one. So there have been several requests for a male version of Mind Over Matter. And I have spoken with Dr. Brown about this. I know, Jill, you've also spoken with Dr. Brown. And at this time, she is not looking at developing a program for men. And there's several reasons why. One being that she had surveyed several gentlemen about going to a workshop for men about incontinence, and there wasn't a very positive, or there wasn't a lot of interest, I should say, in them attending a workshop. And then the other thing is she would need to have another grant and some funding to do the research to make it evidence-based.
Well, is it possible that she could just give us some of the tips and tricks, or like some handouts that we could give to the gentlemen that are calling versus an evidence-based program?
A really good idea. You can certainly ask her that. I was just thinking that as you were saying it. I wonder if there's another resource, because I think what we've heard is that men are interested in it, but they're not interested in the topic. And maybe this is not, obviously this is just in probably a small sample size, but that they weren't interested in attending all the workshops. So if we could give them a resource. Yeah.
I think that goes back to kind of, just like for women, it's not something we like to talk about. And for men in particular, they certainly often are not comfortable sharing that in a group setting. So there is some definite sensitivity around a class for that. But the information, if we could have a definitively a kind of approved source of information, that would be fantastic.
Yeah, that's a great idea.
I do like that idea. And we can always refer gentlemen to pelvic floor physical therapists as well. So there is that other opportunity for them to get some assistance and some help. All right. Well, we'll keep on moving on, but just know that you can always share other ideas or thoughts or needs with us at WEHA at any time. We're always happy to get that information. So now what I want to just do is change gears just a little bit. I want to go over a couple things on our website, talk about data collection, trainees, fidelity checks, and if there's any questions on license renewal, we'll talk about that. So let me just switch my screen here. So hopefully everyone is familiar with the WEHA website. Lots of great information on here, not just about Mind Over Matter, but our team has worked really hard on this website, and there is lots and lots of great information. So a couple of things under programs and workshops, that's where you would find that map. So if you are getting calls from other states on where programs are at, please feel free to refer them back to me. But under the Mind Over Matter tab, this kind of gives a general overview. You can see my screen, correct? Okay, good. I always want to make sure. So it gives a general overview of Mind Over Matter, who it's for, how many sessions, the research, and here are some of what participants are saying, some testimonials about the program. But way here down on the bottom is this wonderful map that Erin has put on. Kind of gives you a little idea of where everybody is at with our Mind Over Matter license holders. So you can kind of click on on the icon, and you can see in Idaho, you're going to contact the Area Agency on Aging of North Idaho, and then their website is there. Now, I hope this is still up-to-date information, but no worries. In your annual report, that's a question that we're going to ask you so that we can make sure that this map is up to date. And hopefully we're going to get some more dots popping up on this map in 2025. So that will be great as well. Okay, let me just go back here to this. I'm going to close this out. One other quick thing, the password protected portion of our website, your facilitators will have access to this as well as you as license holders. So if I click on our Mind Over Matter tab here, again, planning your workshop. Oh, I have too many things that are open and it's telling me that I need to close some things so that my internet can keep up. Sorry about that. So planning your workshop, your planning guide. Every time that I hold a Mind Over Matter workshop, I fill out this planning guide. It doesn't matter how many workshops I've done. This is just a great guide to help me as a facilitator make sure that I've got everything. All my T's are crossed and my I's are dotted. Also here again is where you order your materials. Promoting your workshop, we did add this year, or I guess last year, 2024, some social media posts that you can adapt to your meet your needs and add your workshop information. So there's a few of those. The flyer is here, the brochure, press releases, newspaper articles. Those are all there for you as well. If there are other items that you want for promotional materials, please let me know. I'm happy to work on that. Or if you've already created something like Pam has with the slides, happy to look at those as well. Again, all your in-person and virtual documents are here, research articles. And here's the big thing, the data collection. I know it's optional for national license holders, but we really would appreciate any data that you would be willing to share with us. And then we can share with the research team and the developers. This is really helpful when we're applying for new grants, or there might be new ideas out there as well. So again, just this week, Erin has been hard at work to make sure that all of these pre and post surveys are up to date. And if you are, obviously you are all out of Wisconsin, so here is how you get this information back to our office. Any questions about data collection? Or the WEHA website? That was just a kind of a quick overview of that. Potential trainees. So I just wanted to talk a little bit about potential trainees. Again, for the facilitators, I should say. So just as a quick reminder, they need to be female, be able to or comfortable discussing the topic of bowels and bladder. Sometimes that's not always the easiest for everybody to talk about. Make sure that they've had some experience working with older adults and feel comfortable speaking in front of others. So just kind of keep that in mind if you are looking at having new facilitators trained before you fill out all of the application. And I'm always happy to talk with any potential facilitators before they fill out that application if they have questions about the program. Fidelity check, we are changing that just a little bit, that process. And for our master trainers, I will be having a meeting with just the master trainers to go over some of the details of that. But just real quick, so if a trainee receives an 80% or higher on their key elements quiz and their practice facilitation during the training, they're not going to be required to have a Fidelity coaching session unless they want one, and we have the capacity to do that. We're happy to do it. But if they have scored an 80% or higher on those two, the key elements quiz and the practice facilitation, they will not be required to receive a Fidelity check. And you as as license holders, I will send out an email to both you and the trainee or the facilitator if they do not need, whether they need the facility or Fidelity check or they don't. So I will be sending that out. If they receive a score of lower than 80% on either their key elements quiz or their practice facilitation, a Fidelity check will still be required. And we would like to have that happen during their first workshop, if that's possible. So if you have questions about Fidelity checks, I'm always happy to talk individually with you on that as well. But we were just with the capacity, we thought we could changed that, and the developer agreed with us on the fidelity check. All right. So license renewal questions. If you have any questions about license renewal, Erin Eggert is your go-to person. Again, she helps me stay up to date, and she tracks all of that wonderful information. So if anybody has any questions about licensing, Erin can answer those questions now if you have a question, or you can definitely reach out to her. All right. And we're getting to the end of the day here. So are there any other questions, I should say, before we get to that last slide?
Donna did ask me to ask you, can you provide a fillable attendance sheet?
Sure.
Okay, thank you. I will let her know.
I'm sure that we can do that.
Thank you.
As I look at Erin in the middle of my screen. Erin is amazing with all of her forms and her ability to help me with some of those things. Any other questions? All right. Well, last slide is just a big thank you slide. Once again, Jill is here, Erin's here, I'm here. We're all here to best support you, and with everything with Mind Over Matter. So if you come across anything, don't wait until our annual national gathering in January to talk. Like, reach out to me. You are a high priority when I get emails. I shouldn't say that when Jill is on the call, but I do have.
Oh, that's a good thing. That's a good thing. Yes.
Emails do get to be a higher priority. If our website is not correct on the national map, Erin, do you want them to just hold off and put that information on the annual report?
Yep, that'll be perfect.
So Marianne, you'll just put that in the annual report that you get here coming up in the next few weeks. Well, actually, you're going to get it tomorrow. You'll get the link for all of that tomorrow.
And if you have updates throughout the year, then you can always reach out to me and let me know that. Since we're so close to the annual report, it'll just be easier to keep it all synced together. But in the future, don't hesitate to just reach out to me and let me know, and I can make those updates anytime.
All right. Well, thank you once again for your time, and not only here in this meeting, but for your time with the Mind Over Matter program throughout the year. We are here to help out, so don't hesitate. And if there's no other questions, I'll hang out for a few minutes, but I will give you a whole 35 minutes of your day back. You can tell your boss or not. It's up to you. Thanks, everybody. Have a great day.
Thanks, everyone.
Amy, it's Pam in Idaho, and I'll send you my